As we continue to see a substantial disparity in the relative success and failure of colleges' attempts to keep their COVID numbers down, listeners continue to reach out to me to decry what they see as the lack of seriousness with which some schools are approaching the problem, which they believed are causing the high numbers we see in some news reports. I agree that schools have varied considerably in their approaches, but I think it's important to point out what the crucial factors have been in the cases of schools that have seen large increases, and especially where those increases have altered the very makeup of the infection demographic in their communities. As examples, this week Iowa officials were horrified to find that young adults aged 19 to 25 accounted for 67% of new cases in Story County, where Iowa State is located, and 58% of new cases in Johnson County, home to the University of Iowa. Does this mean that Iowa State and the University of Iowa are both just being sloppy, and that they're generally unconcerned about managing transmission of the virus on campus? Well, it's more complicated than that. And to be clear, what I'm about to say could apply equally to many large universities and smaller colleges. Both of these schools and many others have substantial coronavirus countermeasures in effect and have spent millions of dollars to implement them. However, what we've seen at the University of Iowa and at Iowa State is that while these countermeasures are largely effective on campus, students aren't getting the virus while on campus. Instead, they're contracting it off campus, primarily while they're socializing, and because the University of Iowa and Iowa State don't own the bars and taverns that the students are visiting, they have limited options for restricting the off-campus student partying. But a 60% rise in cases among the 19 to 24-year-old age group isn't just a university concern, it's also a public health concern, which is why Kim Reynolds, one of 6 governors who refused to impose statewide stay-at-home orders in the early months of the pandemic, has made the decision that bars, taverns, and nightclubs in 6 counties around Iowa must close until September 20th. So what can schools do to reduce the transmission rate of the virus? Well, some schools have chosen to penalize students for irresponsible behavior, but I'm skeptical about this approach for 2 reasons. First, I don't really think that there's a single 30,000 student university that has an enforcement apparatus in place that can adequately monitor, investigate, and apply penalties to such a large number of students. This is pretty clear from the data that's available. The schools that are known to have suspended or expelled students for violating their social distancing policies are penalizing very small numbers of students, apparently simply tackling the most egregious cases or the ones that are the easiest to investigate. Syracuse University in New York, for example, which has over 20,000 students, suspended 23 students. Montclair State University in New Jersey, which also enrolls about 20,000 students, suspended 11. Marist College in New York, with an enrollment of just over 6,000 students, suspended just over a dozen. Schools already had a hard enough job monitoring and modifying student behavior pre-pandemic. It's just not clear to me how any school can tack this job on top of what they already do. Second, there's a debate about whether penalties are effective. In many cases, penalties or shaming appear to simply drive the behavior farther underground. By analogy, early attempts to control sexually transmitted disease by attaching a social stigma to those who contracted the disease did not result in fewer people getting sexually transmitted diseases. It simply made people less likely to report cases in the early stages, ensuring complicated and costly medical care later. In the case of the coronavirus, how does contact tracing work when a student has to narc on themselves or their friends and risk punishment by cooperating with the contact tracer? I think what we're seeing at the local level is imitating what we are seeing at the national level. For various political and financial reasons, there is no nationally coordinated strategy to substantially slow the spread of COVID-19. Likewise, even though anyone familiar with higher education could have predicted these effects in large college towns, the system relied on individual people and businesses' willingness to rise above immediate self-interest without any central coordination or mandates that specifically relate to the influx of large numbers of college students into these communities. The governor of Iowa did something that counties and businesses should have come together to do on their own. But like counties and businesses nearly everywhere, they are unable and unwilling to do so because it would require both political will and substantial financial sacrifice. I don't minimize the financial impact on a bar that now has to close during what could be one of its busiest times. But these businesses didn't close because of the coronavirus. They are being forced to close because they were unable to find a compromise that would provide service to their patrons and observe health guidelines. Although it's certainly fashionable to point out how irresponsible students are being, it's much less common to point out how irresponsible some business owners are being. After all, we are quick to place at least some blame on drug dealers when they enable users, and wouldn't we blame gun sellers if they fail to follow the procedures that are intended to keep everyone safe? There's an excellent piece by pediatrician Aaron E. Carroll in the August 29th edition of the New York Times about our perception of risk during the pandemic. School children, they argue to their parents that, well, I see my friends all day in school, so I should be able to see them after school as well. Many of us see risk this way, but it's backwards. If we're going to deliberately engage in risky behavior to achieve some other worthy end goal, like opening elementary schools, then we should be prepared to mitigate that risk by dialing back our exposure in other areas. Once we accept that opening universities carries with it some risk, and we're willing to accept that risk, then the right way to approach that risk is for communities to coordinate their efforts in other areas, to deliberately scale back other activities that contribute further risk. There are at least two ways to do that, voluntarily and involuntarily. This week in Iowa, small business owners had to close involuntarily, and the real reason it was involuntary now was because those same businesses were unwilling to engage in more modest collective voluntary action earlier. I know such action is difficult, or more people and businesses would do it. Businesses are under strain to make money when they can, especially if they had to endure previous shutdowns. One bar owner in Ames, Iowa, who is affected by the governor's order, said, "Obviously, we want people to be safe and healthy, but I also want my business to be totally open and able to do its thing without any hindrance." Pretty much says it all, doesn't it? Until all constituents abandon such a want-it-all without compromise approach, universities, which are only one player in an effort that badly needs coordination, cannot by themselves shape the pandemic for the better, whether on campus or off. I hope this perspective and information has been helpful to you, and I hope that you are safe and healthy under the circumstances. I look forward to talking with you again next week.